2 million children have been displaced since the conflict erupted in mid-April. That's an average of 700 children displaced every hour. The statistics from the United Nations Children's Fund is expected to worsen as the fighting continues there. Now, delivery of health and nutrition services is still a major challenge in these conflict zones. UNICEF is now calling on the warring parties to prioritize the safety and the well-being of children.
An average of more than 700 children newly displaced every hour. That's a terrifying number. And according to UNICEF sources, all states in Sudan are reporting severe shortage and stock out of medicines and supplies, including life-saving items. In areas with high internal displacement and when health systems are stretched, such as the Blue and White Nile states, disease outbreaks, including measles, are resurfacing with reported associated deaths. In addition, it is estimated that 20.3 million people in Sudan will be food insecure between July and September this year. At least half of them are children.
Meanwhile, at least 27 people died in a recent crossfire in Sudan between the Sudanese armed forces and the paramilitary rapid support forces. Now, the medical humanitarian organization MSF says that Nyala city in the Darfur region has turned into a battleground in the last few days. Tens of thousands of residents are trapped. Cass Hospital in South Darfur State is now controlled by armed groups, and that's left civilians with little to no options for medical care. Meanwhile, Army Chief Abdel Fattah al-Burhan has inspected a number of military posts in the city of Omdurman, which is north of the capital Khartoum. His appearance comes a day after the SAF announced control of the headquarters of the Armored Corps camp in the capital.